thank you so much for taking the time to talk with us about interprofessional collaboration in dentistry. And I want to have you start by giving your name and professional experience and your current role.
I'm Karen Quick. My pronouns are she, her. I am a clinical dentist and I also have a PhD in health services research. I'm in dental education now, and my current role is as director of the Division of Dental Public Health, and I also direct global programs at the School of Dentistry. And both of those areas are by nature very interprofessional in what they do. So I've always kind of had that mindset to be interprofessional, whether I was in clinical practice. So I came to education from clinical practice and ended up here because I really like teaching. I really like developing, students to be great professionals.
You alluded to this a little bit, but what parts of your work
Mhm.
requires collaboration, and specifically, could you name some of the people who you collaborate with?
I work primarily currently in both teaching and research on collaborative teams that are interprofessional. They're also across the country and they're also international as well. So I get a lot of different perspectives that way. And that is in part because of my interest in global health. So I have a current partnership that we're working with family medicine and MedPeds and a number of institutions, across 3 states. So that's an interesting project. Teaching and research, they all really just overlap for me because I'm interested in promoting interprofessional collaboration for our students and also for people in the community. We partner with other health systems. I've partnered with other educational institutions too. So with Century College, had a nice project working with them and their spoken language interpreting program there, which engaged us in any number of communities where their students were coming from. So organizations with the Korean community were very active with that, as well as other spoken language interpreter things too with the community in terms of community engagements.
Thinking about different settings where your students will be spending their parts or much of their careers, what's collaboration look like in a typical modern dental practice?
We've been very team oriented in dentistry for a long time. The people that I usually interacted with most often were pharmacists. They were definitely two things, and either a go-to for, I have a question about this medication or this sort of thing and what's going on, and also in terms of helping my patients understand that there are clinical pharmacists that can answer some of their questions when patients have a lot of different medications. So I think in practice, as a lot of interaction with pharmacists, a lot of interaction with medicine, and different levels of nursing in terms of working with patients who may have cancer of any kind prior to chemotherapy and that sort of thing, in terms of ensuring that they are, healthy enough for some of those treatments. And so those are real common. Where you practice makes a difference. So if you are in an FQHC, for example, so a federally qualified health center, you have medical, dental, and maybe mental health services all within the same place. So in those practices, your opportunities to interact specifically, within the same physical structures with people from other professions is pretty much at hand. If you practice like I did, in either a small group or in solo practices, you build your interprofessional relationships across like the community. So you might not be in the same place, but you're still going to have relationships, interprofessional relationships that are going to help you help your patients to connect to those services.
who's part of the team, even though we may not use the word professional, who's part of the team that you're collaborating with?
Yes, there's a lot of people within my office that you would collaborate with. So the dental team, I like to think of it as interprofessional too. So you've got
Yeah,
your dentist, your dental hygienist, your dental therapist, your dental assistant, you have your staff that's there. So you're really running, an entire team with a lot of different skill sets and work together. So we're like little microsurgeons. So every time we do any kind of clinical procedure, um, it is like that. So you have your assistant sitting chair side,
yeah,
helping with some of those things. You're collaborating with your dental hygienist who's doing something within their scope of practice, and also your dental therapist. You're helping, so that you can work at the top of your scope of practice. So all of these other providers, help you take care of your patients, and they do what they're really good at, that is within their scope, and you're able to do some of the more advanced procedures, especially if you're a general dentist. You're able to do that and spend more
yeah.
time. If you really like doing root canals, you're doing a lot of root canals, and you're probably still sending some off to your endodontists to be able to have them do some of those 5 canal mandibular first molars.
The tough ones.
And that's within your own dental practice. And you will, within the field of dentistry, work with a variety of specialists. You may become a specialist as well. And so you will refer to your colleagues that are either endodontists or oral surgeons or prosthodontists, pediatric dentists, depending on what your patient's needs are.
Those are great examples of gives you, it's just really amazing how many different options there are. Who tends to be the leader of those teams, and who would you think is the leader?
From my experience, that I like models that are based on shared leadership, and so different members of the dental team will step up to lead in different areas, and I always like to encourage that. In my practice, it makes it helps with the environment that everybody comes to work in every single day.
Yeah,
If everybody feels like they have this sort of leadership role that they're comfortable with, and it looks different for different members of the team and based on what their interests are and their kind of personalities and some of those things, and so they
sure.
step up in a lot of different ways all the time. And I think that's really important in any kind of environment that you're going to practice in.
I know there are probably a lot of skills to learn for your students, but if you had to pick one that seemed today to be really particularly important when working in a collaborating in dental practice, is there a skill that you'd say, boy, this you ought to work on this because you wish you're going to use it a lot, or that it's particularly important?
I think the things that really are critical: communication skills, communication skills, communication skills. And I think that would be my big answer. And then probably even connected to those is the ability to develop sound professional relationships. Again, that kind of falls under that. And then also kind of a sense of like cultural humility and that sort of thing, and curiosity about, people, whether they're your patients, they're your co-workers, they're your staff, they're your team, they're, the other professionals you work with in the community. I think that those are the things that really, fulfill you as a provider.
Yeah. So communication, I hear communication, I hear relationships, healthy, nurturing relationships, promoting that by trying to really know the people you're in your relationships, to be curious about them as people, and to be open to learning about who they are and humanizing them. And well, I'd love to keep talking, but I think we've run out of time.